Bariatric surgery and preterm birth. Definition. The most effective method of achieving sustained weight loss. It's increasingly performed in women of reproductive age. Some studies have shown that women who have undergone bariatric surgery have a higher risk of preterm birth than women who have the same body mass index and have not undergone bariatric surgery. There are 4 types of bariatric surgery: biliopancreatic diversion with duodenal switch, laparoscopic adjustable gastric banding, vertical banding gastroplasty, sleeve gastrectomy.
Children of women who have been treated with bariatric surgery are more likely to be born prematurely and be small in size for their gestational age, compared to other babies who were born to women who had not received weight loss surgery. Investigators from the Karolinska Institute in Sweden claim that their findings demonstrate that pregnancies for women who have undergone weight loss surgery should be regarded as high-risk pregnancies, and that these women should receive more attention in their prenatal care. For this study, researchers examined data concerning 2,500 babies who were born between the years of 1992 and 2009. All of these infants were born to women who had undergone bariatric surgery. They were compared with 12,500 babies of mothers who had not received weight loss surgery. The study findings revealed that 5.2% of infants born to women who received weight loss surgery were small for their gestational age, compared with 3% of babies who were born to mothers who did not undergo the procedure. It was also found that 4.2% of babies born to mothers who underwent bariatric surgery were large for their gestational age, compared to 7.3% of babies in the control group. In addition, 9.7% of babies were born prematurely to mothers who received bariatric surgery, compared to only 6.1% in the control group. Dr. Olaf Stephenson of the Karolinska Institute explains the findings. Mothers with the same BMI gave birth to babies of varying weights depending on whether or not they had undergone bariatric surgery, so there was some kind of association between the two.
Pros. For many of these patients, an investment in medical weight loss is money well spent, as weight is lost and goal weight is maintained. Bariatric surgery usually leads to the fastest, most dramatic results. With this rapid weight loss comes rapid recovery from a variety of weight-related afflictions, as high blood pressure, sleep apnea, and even diabetes. Bariatric surgery can also have positive effects on subsequent pregnancies. In earlier studies, it was found that surgery reduces the risk of gestational diabetes and was associated with normalized birth size. Cons. Since the food goes through the digestive tract relatively quickly, people run the risk of not absorbing enough nutrients. This also means that less calcium, iron, and certain vitamins from the food is absorbed. It's major surgery, and as such it carries significant risks, such as blood clots and infections. In some cases, more of the small and even large intestine need to be removed. A significantly higher risk of a spontaneous preterm birth has been detected among women who have had bariatric surgery.
Your surgeon will perform bariatric surgery if your weight loss efforts through lifestyle changes and medications have been unsuccessful. There are 2 types of bariatric surgery. Restrictive procedures decrease the size of the stomach so a person feels full quickly. After surgery, the stomach holds about 1 cup of food. A normal stomach holds 4 to 6 cups. Malabsorptive procedures decrease the absorption of calories in the small intestine. Before your procedure, an intravenous line will be started. Bariatric surgery requires general anesthesia, which puts you to sleep for the duration of the procedure. A breathing tube will be inserted through your mouth and into your windpipe to help you breathe during the operation. Gastric bypass, technically referred to as Roux-en-Y gastric bypass, is both a restrictive and malabsorptive procedure because it reduces the size of the stomach and decreases absorption of calories in the small intestine. Your surgeon would use one of two methods for gastric bypass surgery. The open method requires an 8 to 10 inches incision in the abdomen. The laparoscopic method only requires several small keyhole incisions, through which your surgeon will pass a laparoscope and surgical tools. A laparoscope is a thin lighted instrument that projects images of the surgery on a monitor in the operating room. During a Roux-en-Y gastric bypass procedure, your surgeon would use surgical staples to create a small compartment, which will serve as your new stomach. This pouch will hold about 1 cup of food. The lower portion of the stomach continues to secrete digestive juices but does not receive food. Next, your surgeon will cut the small intestine well beyond the stomach and bring one free end up and attach it to the pouch. He or she will then attach the other free end lower down in the small intestine, creating a Y shape. By bypassing the lower stomach and the first part of the small intestine, fewer calories will be absorbed as food passes through this new pathway. Banding techniques are restricted procedures. They help decrease food intake in two ways, by shrinking the stomach to a small pouch and by making a tiny opening from the pouch to the rest of the stomach. Food moves slowly through this opening. These factors make you feel full quicker and for a longer time. In vertical banded gastroplasty, also known as VBG or stomach stapling, your surgeon will cut a window in the upper part of your stomach. He or she will place staples in your stomach around the window and toward the esophagus to create a small pouch on top. Next, your surgeon will pass a rigid plastic band through the window and wrap it around the small outer of the pouch, which will prevent stretching. Food will move from this pouch through a tiny opening into the lower stomach and the rest of the digestive tract. During an adjustable gastric banding procedure, also known as AGB or lap band, your surgeon will wrap an inflatable ring around the upper part of the stomach. As the band is inflated, it will squeeze the stomach to create a small upper pouch and a narrow opening into the larger lower portion. This may be done through tiny incisions using a laparoscope. The band may be adjusted at any time. Biliopancreatic diversion is a malabsorptive procedure that decreases the amount of calories absorbed in your small intestine. Your surgeon will begin by removing part of the stomach, leaving only a small pouch behind. Next, he or she will sew the small intestine to the pouch. This creates a direct route from the pouch to the end of the small intestine. The duodenum and jejunum are bypassed so few calories and nutrients are absorbed. For all methods of bariatric surgery, your surgeon will close your incisions with staples or stitches. After your procedure, your breathing tube will be removed, and you will be taken to the recovery area for monitoring. You will be given pain medication, and your diet will be gradually advanced over several days.
Issue apply in Ecuador. The most common methods of bariatric surgery in Ecuador are bypass and gastric sleeve. There have been cases of women who have gone through this procedure. Some of them had preterm birth, while another group had no complications at all. Conclusion. Patients who undergo bariatric surgery may have lower risk of maternal complications such as preeclampsia and gestational diabetes. Babies born to women who have undergone bariatric surgery are more likely to be born preterm and small for gestational age.